Namaste, good afternoon. I am Chief Administrator of Sivananda Rehabilitation Home and I am working here since 1982 as a medical officer. And I learned surgery, reconstructive surgery at Sivananda itself from Dr. Beni, who is from German doctor. We came here, worked for 45 years. In India, he worked for 55 years. He taught me, he took me as his own child and gave me the knife, and he taught me ABCD of reconstructive surgery. And afterwards, I was being exposed in Germany itself about 3 months for hand surgery. But much of the surgery I learned at Sivananda by Dr. Beni. He is my teacher and well-wisher. And the Sivananda Rehabilitation Home started by Rani Kumudi Devi about 65 years back. She is king wife who is by profession, and she is the first mayor of Hyderabad, and her guru Sivananda has advised her to start a leprosy home, and she came back to Hyderabad and she purchased this 52 acres of land. She registered under a trust. It started with 1,200 patients in beds with the request of government of municipal corporation of Hyderabad. So we moved all the 1,200 people here, and they have been houses were built and they have been rehabilitated, and they have been taught in workshops, weaving and candle making, butti making, in so many rehabilitation, and send them outside to live on their own legs. At present, inside there are about 200 patients, rehabilitated patients who are blind, handicapped. No one is there to take care of them. So those patients we are taking care till their deaths. And whoever wants some rehabilitation here, we are not new joining, we are not allowing them. We are trying to mix up with the general population. We are asking their sons and kids to come here, and we motivate them to take back the badly affected, deformed patients. We have made them, we give MDT here, we give everything. Once they are treated properly, we send them back to mix up with them, whole family, with the society. That is now. The Sivananda, since 1982, or 1979, GLRA has given us some funds to start with Urban Leprosy Control Project, and half of the Hyderabad city was covered by Sivananda under the SULCP. Later on, the General Leprosy Relief Association, Germany and India requested it to start a referral hospital, tertiary care hospital. In 1982, they have gained funds to build a referral hospital, and in 1982, we have inaugurated a tertiary care hospital. And later on, now it is one of the only one tertiary care hospital whole of the Telangana, one of the best in India, where if you want to take the name of the reconstructive surgery, it is only the Sivananda Rehabilitation Home, which is headed by GLRA, is taken care of. All medical colleges of the state, all NGOs in the state, all private practitioners, government hospitals and non-governmental hospitals will refer the tertiary for this hospital for tertiary care, where we admit the cases for severe uncontrolled reactions, for severe bad complicated ulcers, for reconstructive surgery, pre-operative and post-operative physiotherapy, and early deformed case. If they come early, so what we can reverse it back, that neuritis. We got very good full-fledged physiotherapy, 3 physiotherapists working round the clock, and we got all the departments are fully equipped. We have a OPD, full-fledged OPD, we got a laboratory, full-fledged laboratory, and recently we have started one ultrasound mission where we can detect neuritis 12 weeks before it detectable neuritis. There is a subclinical neuritis we can also detect and prevent deformities. And once the deformities occurs, Within 6 months, we collect them by the physiotherapy, and if not physiotherapy is corrected, we do go for the reconstructive surgery. So far, Sivananda has done more than 6,000 reconstructive surgeries in this since 1982, and we try to give MDT, whatever way patient comes, registered here, top to bottom examined, skin smears are taken, and when the patient wants to take the treatment, we give the treatment here. And when the patient wants to take at the peripheral level, we refer back to the peripheral level and ask them to come for once in 6 months. And all the cases were examined for smear, all the cases were examined for physiotherapy, all the cases who needs x-rays, they have taken the x-rays. From A to Z, treatment is available at Sivananda as a tertiary care hospital. We also have a counselor who takes care of depressive patients, anxiety patients, and as the stigma is much more in the society, we try to correct the stigma. Within the first, our main aim is to stigmatize the family members. We want to treat them. We call all the family members. We counsel them. If any wife and husband divorced, we try to counsel wife and the husband. We counsel the in-laws. We counsel everyone. And most of the families, once they have counseled very nicely, they have taken up their wives back. They are living happily. And we try to rehabilitate the patients by giving singing machines, handicapped patients by artificial limbs, etc., etc. And this is in short what Sivananda is doing it. And we take a lot of classes for general public, a lot of classes for MBBS students, nursing students. One day class, we have oriented them, and we trained overseas training also. We give sometimes here in Sivananda, which is full-fledged, and we take regular classes for the primary health medical officers, government medical officers, government physiotherapy, so that they can go in turn, go to the primary health centers. Whatever training we have given them, they can implement, so that they can prevent the deformities as early possible, so that the families, the society is not stigmatized. I feel strongly that stigma will go only if we stop deformities in the society. As long as the deformities are seen in the society, whatever we teach them and all that, still people never believe in that, because they see the deformity, disability, disfigurement that is causing the stigma. The stigma has to go along with the signs and symptoms, along with the case demonstration. We have to treat all the deformity cases, prevent the deformity cases. To prevent the deformity cases, we have to treat, diagnose leprosy as early as possible, treat with MDT, and if a disability is there and by physiotherapy we can treat them. Thereby we can slowly change the people's attitude from stigmatized to non-stigma, so that leprosy is totally curable, and they should think that leprosy is also a small skin disease, where skin dermatology, any skin diseases, we go to the dermatology and treat within 3 to 6 months. Leprosy is treatable 6 months to 1 year. It is very easily treatable and can be curable at every stage. Leprosy is totally curable, preventable. Deformities also can be prevented as early as possible once they take the treatment. Only they should be diagnosed at the patch level, and we should tell to the people that the patch with a loss of sensation, every public should know that if they see a hyperpigmented or erythematous patches, they must go and report to the nearest health facilities, nearest NGO, and get treatment, diagnose, get treatment. Treatment is very simple. Depending upon the stage, it is 6 months to 1 year, and also there we got Medicines are freely available. Government is giving MDT free at every level. They need not spend a single pie. Only one thing is diagnose early, treat early, stop spreading, stop stigma. That's all.